Diphtheria is a contagious, sometimes fatal infection of the upper respiratory tract caused by the gram-positive rod-shaped bacteria. It releases a potent toxin that can damage the heart, kidney, and the nervous system. The bacteria that cause diphtheria are usually spread in droplets of moisture coughed into the air. Usually, the bacteria multiplies on or near the surface of the mucous membrane of the mouth or throat, where they cause inflammation. According to experts, it may also extend into the windpipe or airway or suddenly become detached and block the airway completely. When inhaling, the pseudomembrane may cause people to make a noisy gasping sound. The illness typically begins a few days after exposure to the bacteria. Symptoms include a sore throat, general feeling of illness and fever, sometimes with swollen lymph nodes and a tough gray pseudomembrane forms in the throat. Experts say diagnosis is based on these symptoms, particularly a sore throat and the pseudomembrane. Years ago, diphtheria was said to be one of the leading causes of death among children. Today, diphtheria is rare in developed countries, primarily because of widespread vaccination. Fewer than 5 cases occur in the United States each year, but diphtheria bacteria still exist in the world and can cause outbreaks if vaccination is inadequate. Outbreaks in Indonesia, Thailand, Laos, South Africa, Sudan, and Pakistan have occurred since 2011. Diphtheria is common in many countries in Asia, the South Pacific, the Middle East, and Eastern Europe, in Haiti and the Dominican Republic, and now Nigeria. Yes, you heard it right. Diphtheria has found its way into the shores of Nigeria, as confirmed by the Nigeria Center for Disease Control, NCDC. NCDC says in addition to clinically suspected cases, there had been laboratory-confirmed cases of the disease. The latest reports from states shared with the agency as of January 22 show about 123 confirmed cases and 38 deaths were recorded in 4 states. This forms the basis for Global Health Digest this week. What is diphtheria? Who is at risk? And what can we do to stay safe? This and more when we return.
Diphtheria is a serious infection caused by strains of bacteria that make toxin. It can lead to difficulty breathing, heart rhythm problems, and even death. Diphtheria bacteria spread from person to person, usually through respiratory droplets, like from coughing or sneezing. People can also get sick from touching infected open sores or ulcers. The bacteria most commonly infects the respiratory system, which includes parts of the body involved in breathing. When the bacteria gets into and attached to the lining of the respiratory system, it can cause weakness, sore throat, mild fever, and swollen glands in the neck. In 2015, 4,500 cases were officially reported worldwide, down from nearly 100,000 in 1980. About 1 million cases a year are believed to have occurred before the 1980s. Diphtheria currently occurs most often in sub-Saharan Africa, India, and Indonesia, down from 8,000 deaths in 1990. It is rare in the developed world due to widespread vaccination, but can re-emerge if vaccination rates decrease. People who are at increased risk of catching diphtheria include children under 5 and adults over 60 years old. Also, people living in crowded or unclean conditions, those who aren't well nourished, and children and adults who don't have up-to-date immunizations are also at risk. In addition, close contacts of someone with diphtheria should be monitored for possible illness for 7 to 10 days from the time they were last exposed. They should be tested for diphtheria with a sample collected from the nose and throat. and giving a diphtheria booster shot if they are not up to date with their vaccines. Keeping up to date with recommended vaccines is the best protection against diphtheria.
We also went to the streets to know what individuals are doing to stay safe with the outbreak of various viral and contagious infections.
You know about the disease called diphtheria?
I don't know anything about it. I'm just hearing for the first time.
Well, honestly speaking, this is my first time of hearing this disease. I don't know much about the disease. This is my first time.
Okay, sir.
I don't know so much about it, if to be honest. But I read in the news that there's an outbreak of such disease in some states of the federation, and that the disease affects throat and all that, and seizes one's breath. That's all I know, but the cause of it, I don't know. We've not been told if it is contagious or not. But however, at individual level, there's a saying that cleanliness is not to godliness.
Diphtheria, no, I don't know. I'm just hearing for the first time. Well, I do everything possible that I can do at my own time and way. So that is just everything. I take care of myself, maintain my hygiene, um, exercise, keep out the stress and the fatigue. That's what I normally do.
You're welcome back. Global Health Digest seeks to know the causes of diphtheria and its symptoms. And so we spoke with the head of surveillance and epidemiology department of the Nigeria Center for Disease Control and Prevention, Dr. Oyeladun Okunromade.
Diphtheria is a vaccine preventable disease. Is caused by bacterial organism known as a gram-positive Corynebacterium diphtheria. So this organism produces toxin, and in a layman term, toxin means poison. And once this toxin is released into the body, it starts manifesting in different symptoms, such as fever. There may be difficulty in breathing. Individual will start experiencing sore throat. Sometimes there may be a thick gray white patches at the back of the throat, and this can lead to the blockage of the airway, making it difficult for an infected person to either swallow or sometimes to breathe, and this can lead to death if the case is not reported promptly. The symptoms usually start between 2 to 5 days after exposure, and it may also lead to neck swelling due to an enlarged lymph nodes. Well, like I mentioned, diphtheria is a vaccine preventable disease, which can easily be prevented by Nigerian childhood immunization schedule that is recommended, 3 doses of diphtheria toxoid containing vaccine known as pentavalent. This vaccine is usually given to children in the 6th, 10th, and 14th week of life. The vaccine is available in the immunization schedule that is usually given by our sister agency, Nigerian Premier Care Development Agency. And the recommended schedule or the dose is usually 3 doses of pentavalent. So the vaccine is called the pentavalent vaccine. Pentavalent means 5 vaccines in one that prevent 5 childhood illnesses, such as it prevents not just diphtheria, contain also vaccines that prevent pertussis, vaccines that prevent tetanus, hepatitis B, as well as Haemophilus influenza type B, which usually cause meningitis, severe pneumonia, and others. And this vaccine, usually the recommended doses, we have 3 doses that is usually spread between 6, 10 to 14 weeks of life, and available, cost effective, and it's free. It's caused by a bacterial organism known as Corynebacterium diphtheria. This organism actually releases toxin, like I mentioned before, that once this poison is released into the bloodstream, an infected individual will start manifesting symptoms that could sometimes be life-threatening if it's not picked early in time. But there are different modes of spread, which if an individual is exposed to, can increase the risk of transmission. These include somebody living in having a kind of a contact with an infected person, or sharing of materials with an infected individual, or individual living in a crowded environment, or people living in a poor sanitation. But it's mainly a bacterial infection that thrives in a poor sanitation environment, or that thrives in a very crowded environment. It cut across different age groups, but most susceptible to these infections are children, especially children that have not received any single dose of pentavalent vaccine. They are more at risk. Adults are equally at risk, especially now during outbreak, if they have not received any single dose of this vaccine. And also at risk are health workers and others who are exposed to either a suspected or a confirmed cases of diphtheria. So it cut across all age group, it cut across gender as well, but more prevalent in children. So this vaccine actually are supposed to be taken at, the vaccines are supposed to be taken during childhood. But looking at the outbreak and what is currently going on, there is every evidence is pointing towards low immunity in the country, which means the immunity for this vaccine has waned off within the community, or those that are the population that have not been vaccinated, they've overridden the vaccinated population in terms of numbers. So the one of the approach is to ensure that we're working closely with our sister agency, Nigerian MPACGA, to ensure that we make booster available, especially at this period, targeting a particular age group based on the data available to us now, which may not really be available to all age group at the moment. But for those that are in contact with confirmed cases, there are prophylaxis, because we know that this diphtheria is treatable using antibiotics, and for the contact of the infected individuals, they are also advised to take prophylactic antibiotics. Currently, the state that's reporting the highest cases so far as of today is Kano State. Kano State currently has 169 suspected cases reported. Out of this 169 reported cases in Kano, we have about 107 confirmed and 32 deaths so far. Lagos State has 5 cases reported, but only 1 confirmed. Others are clinically compatible, with total 3 deaths in Lagos State. Yobe State has 78 cases reported with 3 deaths, while Osun has reported just 1 case with 0 deaths. so far in Nigeria. If we're talking about the total case fatality so far, we're looking at about 20% case fatality among the reported cases across the country. The federal government of Nigeria, through Nigeria Center for Disease Control, is working closely with state government to respond to this outbreak and to control the spread of the outbreak. So I want to use this medium to tell the public not to panic. We have adequate clinicians across the state, across all our states, across the facilities, to ensure adequate capacity to promptly identify, diagnose, and control this outbreak. We keep advocating for high index of suspicion among the clinicians, but at the same time, early reporting is the key. So when individuals notice any form of symptoms of this disease, they should promptly report to the facility closest to them on time. From our hand, also at the national, we have received a stockpile of diphtheria antitoxin in country. This is antitoxin that is given to any infected individual if diagnosed on time. We have received enough stockpile in readiness for this outbreak. Also, we're supporting states that are reporting cases with antitoxin treatment currently. At the national, we've also developed different surveillance guidelines. We've shared the case definition across to all the states. And we have deployed the National Rapid Response Team also to support the state in active case search, as well as in diagnosis and even in case management and even in sensitization of the public. And we've released a series of public health advisories as much as possible. And in terms of our laboratory capacity, in conjunction with our partners, we've trained our staff in the lab, as well as the selected public health labs across the country, to ensure that we increase the diagnostic capacity for diphtheria in Nigeria. So what we are witnessing now is, as a result of an improved surveillance and improved laboratory capacity, now we have more labs that can easily diagnose this bacteria. At the same time, we've trained our clinicians to be able to identify this promptly and also to report to the right channel. So we're witnessing not just a resurgence, a re-emergence, but at the same time, improving our surveillance and laboratory capacity. And in country, we've also stockpiled the reagent for diphtheria, and this has also been, we have also supported the public health laboratories across the states with the diphtheria reagent for testing to enhance their laboratory capacity across the country. So far, that is what Nigeria is doing through Federal Ministry of Health, is doing through Nigeria Center for Disease Control to support the state to curtail this outbreak. Era of face mask, definitely no, because the mode of transmission and the mode of prevention of diphtheria is totally different from what we have experienced with COVID-19. This particular outbreak, the main primary goal mode of prevention is vaccination and early presentation of cases and treatment, because it's treatable. And the treatment is with a simple antibiotics and administration of diphtheria antitoxin when picked promptly. And also, we follow up contact of an infected individual with prophylaxis antibiotics. So it has absolutely nothing to do with face mask. And there is no need to panic. We're not going back to the era of face mask. We encourage mothers, we encourage caregivers to ensure that their children get vaccinated. We encourage everyone having any signs and symptoms related to diphtheria, be it fever, sore throat, difficulty in breathing, backache, cough, should present to the hospital early Early presentation to the health facility is the key.
The Nigerian government is putting everything in place to curtail the spread of this disease. Top on the weekly ministerial briefing was diphtheria. We bring you excerpts from the briefing by the Minister of Health, Dr. Osage Ehanire.
I would say that an increasing number of diphtheria cases, a serious bacterial infection that affects the nose, throat, and sometimes the skin of an individual has been observed in the country with attendant mortalities. In addition to clinically suspected cases, there have been laboratory confirmed cases, and NCDC is working with the state ministries of health partners to enhance our surveillance and response to the outbreak. This includes keeping the public informed on staying safe at home and in their communities, and giving the suboptimal coverage for the third dose of diphtheria contained in the pentavalent vaccine, 54%, based on the 2021 mix and mix study in the country. It will not be surprising to have more cases across states. In view of this, we have also deployed rapid response teams to support all the states affected, and we've also written to all states' health commission and honorable commissioners of health to institute immediate and necessary public health measures for timely detection and response to diphtheria at state level.
If you do not have ventilation, you don't have air changing, you are increasing the risk of infections. And we advise today that if you are crowded inside an elevator, which is sealed while you are going up, you are at higher risk of getting infected. You should have a mask on. If you're inside a crowded room where all the windows are locked and there are too many of you, it's crowded, you should also have a mask on. That is your own contribution to protecting your own health. Okay? Because, yes. You see mine?
Yes.
Okay, so when I get in the elevator, I still put it on. That's the advisory. It's not compulsory, but it's an advisory to assure you that every disease outbreak everywhere is given the full attention by this ministry, and nothing is left that is our duty to do. But that we also expect all states to understand it's a shared responsibility where they too have their role to play in managing some of the social fallout.
Great assurance there from the Minister of Health. You and I have a role to play in ensuring that we stay safe and stay healthy, bearing in mind that the responsibility of our health is in our hands. We have come to the end of this week's episode. Stay safe, stay healthy, till we come your way again. I am Uche Ugochukwu. Enjoy the tidbits.